Well, good morning or good afternoon, depending on what time of day you're actually watching this. My name is Dr. Julia Lewis and I'm a consultant addiction psychiatrist and I've worked with NHS addiction services for more years than I care to mention. And I've been asked today to talk about the effects of alcohol combined with prescribed medication. Working with people who are over 50 and you're thinking about prescribing any type of medication really, just be mindful of the potential effect that alcohol can be having. And I think when people have done research looking at drinking in older adults, one of the things that comes back over and over again is that professionals, particularly professionals who are a lot younger than the person they're talking to, seem quite embarrassed sometimes about asking the questions about how much somebody is drinking. This is a legitimate question. It is part of your clinical questioning, enabling you to make a right decision about what to prescribe. So I think the only way in which you can maybe cause some embarrassment for the individual is potentially in the way you ask the question. And sometimes just a simple thing such as saying, look, this is a question we ask everybody because it is really important for us to understand the safety of what we're prescribing. Can I ask you how much you drink? When I was in medical school, there was this awful thing about you took what people said and you doubled it. Okay. Research has actually shown, and this is research in primary care in particular, that people are generally quite truthful when asked in the right way. If they think they're going to be penalised in some way for how much they drink, then they may not tell you the right answer. But if they think it's helping them in the long run, they're often quite truthful. So ask the question and then think about the potential way in which alcohol could impact on the medication you want to prescribe. So is it a medication that is affected by the same metabolic systems in the liver that alcohol is? And as we know, sometimes alcohol speeds up the metabolism of some drugs, sometimes it slows it down. So you need to be aware of that. Secondly, alcohol is a sedative. So if we are prescribing other sedatives, particularly combinations of sedatives, so we do see people presenting services that are being prescribed one of the gabapentinoids like pregabalin plus diazepam or pregabalin plus an opiate, and then they're drinking heavily on top of that. You've got multiple sedative drugs all in the system at the same time. And as they age and liver function reduces, then obviously the ability to metabolize all of those drugs goes down and you've got toxic levels start to increase in the circulation. And then of course there is the issue that alcohol does worsen some of the conditions you're trying to treat. So people that are hypertensive, alcohol increases blood pressure. People that are depressed, alcohol causes depression. People with anxiety, sometimes early morning anxiety is actually alcohol withdrawal. So you've got that sort of the mixture going on as well. So always ask a full history of alcohol and other substance use. Explain to the patient why you're doing that, and then they'll be on board with that. And then if the patient then turns around and says, gosh, am I drinking too much and I want to do something about that, make sure you are able to signpost them to the right sorts of services. In the Rhondda and Taff area, that would be Drinkwise Age Well, and they would particularly deal with people in the 50 and above category, and they have the expertise for working with that client group. So make sure you have that information to hand so you can assist them.